Hey, GLP-1 plus sides community. Before we jump into the podcast, please take the time to leave us a 5-star review on whatever audio platform you're listening to the podcast on. Share your story and how the podcast has helped you. This will help us get referred up in the audio platform so that we can reach more people that need our help, our support, and guidance from our doctors. Help us get loud and change things. Are you interested in understanding GLP-1 medications like Ozempic, Wegovy, or Mounjaro? Then join us on the Plus Sides, Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus Sides podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, Wegovy, or Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to the Plus Sides, Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus Sides Podcast. You're not alone. It's not your fault. Hey everyone, before we dive in, I really want to share something personal with you. About, I want to say like 8 to 10 months ago, after losing 100 pounds on GLP-1s and keeping it off for a long time, I started regaining out of nowhere, and I was terrified. But I also started having hot flashes and bouts of crying and snacky cravings and waking up at 3 a.m. unable to go back to sleep. It turns out I was in perimenopause. So I started hormone replacement therapy, which is also called HRT, through a telehealth called Winona that specializes in this. And it changed everything. And now I'm sleeping better. And my hot flashes are all but gone, thank God. And I feel like myself again. And it turns out that you can actually start perimenopause as early as 35. And well, I'm 46 and she's here. HRT has really come a long way and there's just no need to suffer anymore. So if you're like this and you're in the same boat, you can check out buywinona.com and you can use the link in our link tree to save some money.
Want the fastest working GLP-1? For half the price, Ro now offers FDA-approved weight loss injections cheaper. With results you can see faster. Lose 15% of your weight with the formula from Eli Lilly that hits not one, but 2 hormones to curb hunger and nausea. Weight loss faster. Confidence higher. Price cheaper. See if you qualify at ro.co/TV.
Are you interested in understanding GLP-1 medications like Ozempic, Wegovy, or Mounjaro? Then join us on the Plus Sides, Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus Sides podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, Wegovy, or Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to the Plus Sides, Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus Sides. So tonight we have Sabrina and Kat with us. So we'll just go around. So my name's Kim. For those who are new, this is the Plus Size Podcast. We focus on education around the diseases of obesity, disorders like PCOS, insulin resistance, etc., type 2 diabetes, and learning different ways to treat that. And that could be with medication. That could be other things to support being on medication, or it could be if you can't, because we've learned a lot of people can't, right? Just different ways to be able to treat your conditions, to understand them, and then be able to advocate for your health. We are an award-winning podcast. This is our third season. We really grew out of a TikTok community, and we've come here to the YouTubery and the Apples and the Spotifys and all the places to spread the GLP-1 gospel. Hallelujah.
Hallelujah. One First Lady Sabrina.
And we invite on people from our community to tell their stories, as well as doctors to be able to validate those stories, so people can heal and hopefully grow. And we hope that you will stay with us. And that's me. I'm Kim. And what about you? Who are you, Kat? What you doing? Why are you here?
I'm Kat Carter. I am I'm a Libra. Okay, we're not going to go through that again. So I'm Kat Carter. Kat Carter 7 on TikTok. I am I'm a user of GLP-1 medications and therapies. Definitely here for all the health and science facts and data. And it's really been a joy. It's great work. Lost 70 pounds. I guess, with the addition of Sabrina, we're now the two fitties.
Yeah, that's right. And JT and I are soft era. I strength train.
You call yourself a fitty. Do it.
No, that's a little harsh. It's a little much. Okay. I do the bare minimum. Okay. And I'm all right with it.
Well, Dr. Allie said, 10 minutes, 3 times a week
yes,
is really all you need?
Yes, I do 5 days a week. So
do it. But, yeah. So binge eating disorder, recovery, Mounjaro, 70 pounds, all that jazz. It's done a lot of great things for my health as well. And I'm going to keep preaching the gospel because we are Kim's first ladies. Kim is the Pastor Kim?
Pastor Kim.
Fearless leader.
Fearless leader, sure.
But she's a GLP-1 evangelist, so we got to
GLP-1 evangelist. That was like my first viral. Hell yeah, it is. Hell yeah, it is. Because it was and still is. Hey, who are you, Sabrina? What you doing? How you here? What's up?
Hey, hi, Sabrina Ramos. I am on a GLP-1. I've been on Mounjaro since June of 2023. I am down 70 pounds. I was diagnosed with type 2 diabetes and obesity last year. I also, like Kat, love to work out. I am a gym enthusiast. I wouldn't say I'm a gym girly, but I am a gym enthusiast. I do enjoy lifting. My passion is the leg press, but I love it.
But you can tell with your booty, and I compliment you every time.
Hashtag doing butt stuff at the gym.
Butt stuff. That's right. Butt stuff with Kat and Sabrina. It should be a whole thing. When you're here, you guys should go to the gym. Anyway, back to the show. So today we have Priscilla, who we call PMAC, to come on and tell her story, and then a special guest. But we are heavily focused today on how obesity, insulin resistance relates to the heart health and how these medications can help with that. So without further ado, let us invite on our friend, PMAC.
What's up, PMAC?
Hi.
So we are so glad to have you here today. I know you know our show, and you've been coming to our lives and stuff for a long time. And we're thrilled. I would like to offer you the space to tell your story unfiltered and uncut.
Oh, I appreciate that. Well, first of all, thank you so much for having me. I've watched all of you guys for a long time, and I can't describe the impact that you've made on my life. So thank you so much for that. So I'm going to take you back to the beginning, I guess. There are only 2 times in my life where I can remember not being overweight. First one was being a premature baby at 2 pounds, 6 ounces. And the other time was between roughly 2016 and 2018, when I had my lap band surgery. Success, and I'll explain what success actually is. So I was overweight my entire life. And being an overweight child, I grew up with parents that were both overweight, both type 2 diabetic, and overweight runs in my family. So I was pretty much genetically going to be disposed. I have one sister. She hasn't really had a weight issue her life. However, I learned that through time, she's been white knuckling it this whole time. So I never knew that. But I grew up in an environment where I danced. I did competitive dance. I did dance in school. And I think the first realization that I was not of average weight was probably 6th grade, when we had to go look for leotard and tights, and we could not find any in a size extra large. So back then the internet wasn't really a thing. So we were having to search high and low to find leotard and tights. And being in competitive dance and having to order costumes every year, that became difficult. And I remember being, let me back up. We had to audition for our competitive dance team, and I was just the same talent-wise as everybody else. Walked up to the sheet that showed all the names of everyone that made it, and I was standing behind a girl, and I vividly remember her going down the list of names of people that made it. She got to my name, looked at her mom, and said, "I cannot believe she made the team. She's too fat." That was the first time that I think I finally realized what was going on. So I then went to a performing arts middle school, did ballet, did modern, and my 8th grade year, my mom was pulled into a parent-teacher conference with my dance teacher to talk about my weight. That was the second time I remember having a conversation about it. And Mama Bear did what Mama Bear does, and she tore into my dance teacher. She was like, "How dare you talk about my child's weight? Clearly she is athletically sound to do everything else that all these other students can do, but how dare you?" Moving into high school, I went to a performing arts high school, and the only way I can describe it is that it's like the movie Fame, but we don't jump up on the tables and dance and sing, but it's like the movie Fame. And from my middle school to my high school, it was a known thing that if you went to that middle school, you were automatically going to go to that high school. You were kind of legacy-ded. And my sister went to the high school too. So it was kind of like, okay, this is kind of a no-brainer. It's going to happen. I got rejected. That was the next time I realized it. And, you know, being in the dance world, weight is very, very important. But that does not mean that you are not talented. I look back then to what I see today, and you just see these people that are dancers, and it's amazing that they're finally being accepted. So I had to re-audition for my high school, and I made it in, performed, did everything just as fine. And then, you know, life goes on. You go to college, and you continue to do what you do. And by the time I got out of high school, I was a size 16. And then went to college, stayed between like size 16, size 18. So in college, I got to about a size 20. And then incrementally, just going into the corporate career, I continued to put weight on. Fast forward to 2006, I started getting migraines. Migraines run in my family, so we didn't really think anything of it. The migraine continued to get worse and worse and worse, to the point where it was affecting me being able to eat. I couldn't keep water down. My vision was getting really, really messed up. And to give you a visual perspective of what was happening to my vision is that I remember trying to drive home one day, and I was in the middle lane. The lanes on this side and this side were physically crossing in front of me. I had double vision. What was happening is my optic nerve was being pushed on and caused this eyeball to go this way. Long story short, I was diagnosed with idiopathic intracranial hypertension. which is with an overproduction of spinal fluid in your body. The best analogy I can give you is that if you think about a toilet and it gets stopped up, your spinal fluid goes up your spine, around your head, and back down your spine. And when your body overproduces too much spinal fluid, it gets backed up. And so the more it gets backed up, the more pressure it puts on your brain. And that pressure was pushing on my optic nerve and caused my eyeball to turn. That condition in of itself is rare. It's about 1 out of every 300,000 people. There's no known cause. There's no known cure. It's just commonly amongst women of childbearing age with a history of menstrual problems. And your temporary relief is spinal taps. So I've had probably about 12 spinal taps in the last 20-ish years. And if it's not regulated, it can eventually cause permanent blindness. So that was number one, traumatic situation of health. We got that under control with the help of my neurologist. He is the one that actually suggested weight loss surgery. And I got approved for the weight loss surgery. At the time, lap band was the big thing. I did the lap band in 2009. At my highest weight of lap band, I was at 290 pounds. And I got down to 115 pounds. Now, by all outside looks, I was successful. I cheated it. My dad had gotten diagnosed with cancer in 2009, and I wanted to prove to him that I could lose the weight. So you figure out a way around the band. Kim, you know where I'm going with this. You figure out what slides and what doesn't. And anybody that's had lap band or any type of bariatric surgery, when you eat something and it gets stuck, immediately that look. Hang on. Ooh, I don't talk about all this stuff.
I know. It's a safe space, though, especially with me. You know that.
Yeah.
Kim is known to break people into tears. It just happened.
So.
Quick pause here. I've had moments on my GLP-1 journey where insurance changes or rising costs force me to look for a new provider. And honestly, that process can feel very overwhelming. But that's why the Plus Sides podcast is partnered with GLP Winner to give our subscribers a resource to help them make that decision easier. GLP Winner is a comparison platform that lets you explore telehealth providers in all 50 states, whether you're looking for brand name medications or compounded options. You can see pricing up front, read reviews, and get a clear picture of which provider might align best with your needs. Check it out today at glpwinner.com/plus-sides. That's glpwinner.com/plus-sides. Don't forget the Z. Let me tell you a quick story. I was telling Kat how I was regaining weight after my 100-pound loss using GLP-1 medications, and I was having snacky cravings and waking up at 3 a.m., and I had hot flashes, and I was worried. But Kat was like, listen, I went through this last year. It's perimenopause, and I started HRT, and she used this company called Winona. So I started going there to see if this was something that was going with me. Turns out it was, because I'm 46. And it's been amazing. It's taken a while to find the right dose, but once I did, it's just been huge. I've been sleeping. I feel more myself again. And the hot flashes are gone, which is, really bad. So I will tell you, it's just been so big for me. And so I wanted to partner with them on the podcast because obviously many of our listeners are going through this same age range and definitely are having these issues. And there's just no need for you to suffer. So if you go to the link that's in our link tree, you can click on that and save money. If you go there and you meet all the criteria, and this might be something for you to try. So I just want to make sure you had this great resource because it's just been such a big difference for me and Kat. Again, you can go to the link in our link tree and get what you need.
"20 seconds a week to lose 20% of your weight in a year with diet and exercise. That's the power of GLP-1s through Ro. Ro helps find the medication that's right for you, based on cost, availability, and your weight loss goals. Losing weight with GLP-1s is possible through Ro.
I didn't even do anything.
Ooh,
All right, make you laugh a little.
I know, right?
Right. Got you.
So I realized that I could get stuck and get rid of the food. And I let this happen over the course of not months, a couple years. And essentially, I became bulimic to the point that it affected my relationship with my sister, that she would not let me around her kids because she didn't want her kids to think that that was acceptable. But in my mind, I rationalized it because when it came up, it was solid chunks. It wasn't all the gunk. So I made myself think that it was okay. And if it came up, it's fine. I'll just go back and eat a little bit more and see if it'll stay down. And that happened for a few years until it finally caught up with me that I ate something I shouldn't have and my lap band got stuck. Had to go to the emergency room, have it deflated. And then we were going to slowly build back the fluid to where I could get back to the restriction level that I needed. And I was going to do it smart this time. But, life happens. I just didn't keep up with the pills. So now that's around 2018. My mom passed away in 2020, but I was continually, gradually putting the weight back on. And then we fast forward to May 2023. I was now at my heaviest of 292 pounds. And I started having some chest pains. And I've never had acid reflux. I've never had any of that. So I thought, well, maybe it's just some acid reflux. So the first time it happened, I went and grabbed an ice pack and sat it on my chest, went and laid down for like about 30 minutes and the pain passed. I noticed that I'd gotten really, really sweaty when it happened. So it passed. And then about 3 or 4 days later, I was up late working one night and the pain hit hard. And it's right here in the sternum. And I told my boyfriend, I was like, I think I need to go to the emergency room. And when it happened, I had gotten super, super hot. And I told him, I was like, I just need to go lay down on the tile bathroom floor where it's cold so I can try to like cool off a little bit. And at one point, I know that I was actively starting to pass out because he was talking to me and I could not make out what he was saying. So thankfully, we literally live right across the street from a hospital. So we were actually just able to go over there, went in, and they had me in the waiting room for quite a long time, to where the pain had subsided. They put me on like some saline just to try to rehydrate me and stuff like that. And then while we were sitting there waiting, it started happening again. And this was an unbearable pain that I can't even describe. It was worse than my worst migraine. And so they ended up admitting me, and they did angiograms, CAT scans, all the testing that you could do. And come to find out, I had a heart attack. So it was initially described to me that it was spontaneous coronary artery disease, dissection, which is where within your arteries there's a lining, and that lining tore. And when there's a tear in the lining, what happens is that as your blood flows through that lining, it starts to pillow and pocket in that tear, causing your artery to eventually possibly close. It's known to be, from all the research I've done, it's known to be most common in women ages like 40 to 50. Usually they've undergone like a recent traumatic event or a recent stressful event, like a dramatic pregnancy or something like that. And my cardiologist was so baffled because he asked me, he's like, have you had anything like that? Like, have you had a traumatic experience? And I was like, no. I'm like, the only stress I really have is just work, and that's it. So they kept me in the hospital for about 3 or 4 days, and they said it was SCAD, the SCAD. But then they also said at some point within that time frame, I had a heart attack. So now we know what we're working with. I get out of the hospital, and if that's not a wake-up call, I don't know what is. And so I then decided, okay, we got to get serious about this because clearly your health is not in the best shape. So I then go back to my bariatric surgeon, wanted to get the band filled so I could start losing some weight some more. They send me off for an upper GI, and then I go back to the surgeon and he says, well, we're not going to fill you. And I go, why not? He said, because according to your upper GI, you're at the restriction level you need to be. I was like, clearly, I'm not. So then I didn't receive any additional support from them, no recommendations, just that's all we can do. Oh, but you can take my copay money, I'm sure, for not telling me anything. So then I decided, okay, well, it's up to me. I've got to figure it out and do what I got to do. So I started looking up like calorie deficit eating. What can I start changing things out for? And I started working on that, and I was having a little bit of success. I mean, within about a month, I dropped about 10 pounds just making lifestyle changes, and I cut soda completely. Haven't had a soda since freaking July, I think, which is amazing. And then about 3 weeks after my heart attack, my friend messaged me and just checking up on me. And she's like, hey, how are you? I'm like, oh, I'm good. I've lost this much weight, trying to do it on my own. And she's like, oh yeah, I lost about like 13 pounds in 13 days. And I was like, I'm sorry, what? Because I had already started researching these medications, but I don't have health insurance. And so I didn't think this was going to be something that I could even think about. So she told me about compound. And I was like, I didn't even know this was a thing. Let me start researching. Enter TikTok. I was not a TikTok person at all. But I can't tell you, I've learned so much about this medication on TikTok that now my friends are coming to me asking me questions about the medication. So that's been amazing. So I got compounded semaglutide. Started that on July 13th. I am currently now down 57 pounds as of this morning. And to say it's been a game changer is an understatement, because from the idiopathic intracranial hypertension aspect of it, it is helping with that, with my migraines. It is helping with my blood pressure. I'm currently still on a statin and blood pressure medication just as a precautionary situation, but blood pressure's come down, and I just overall feel so much healthier with everything, with the way it's going. So that's the biggest nutshell that I could put it into. But I am so appreciative of these medications, what they do. I shout it from the rooftops, and I know that I would not be here where I'm at today had it not been for this community and this podcast. So that's my story in a nutshell.
Love it. It was awesome. I
Thank
think
you.
it's really interesting how many people we meet that like the language that they use when they're talking about like tricking the lap band and things like that, right? And like I think for me, we're friends, is that I have learned to forgive myself because like it really is just your brain that thinks it's starving. Like, you know what I mean? Like it really is. Like, and it makes you feel like you have to do it until it's all you can think about, and then you give in because you are just a biological creature, like, and it's helped me so much with that because there was so much of the like negative self-talk. And I think many of our friends that have had any kind of bariatric surgery, say the same types of things, and like, I hope that it's helped you with that too.
Oh yeah, that's one of the biggest things that I learned, is that what the bariatric surgery can fix mechanically within your body, the GLP-1 fixes your brain. And that was the missing element of all of it.
Yeah, the biology. Yeah, I think that's when y'all know I haven't had a lot of sleep, so I get a little crazy. And Libby, you can cut this if it's weird. But like when the CEO of Weight Watchers was like, we were missing the other pillar, biology. I'm like, shut up. Shut up now. You've been here 2 years. You're a nice lady. Go work somewhere better. But no, you're a diet. Anyway, I don't know. Just when we said that, it triggered me.
And one other thing that I want to bring up too, and if she wants to weave this in, she can. Yeah. Lydia, there we go. is after my heart attack, when you're in that headspace of trying to figure out what is your next move and how do you get to your healthier state the quickest, something that people do not talk about is you mentally go through a state of depression. And y'all's podcast with Dr. Toomer, I remember it clear as day. I was driving on the road and she dropped the bomb of cardiac depression. And as soon as she said that, I was like, that's exactly what I've been feeling, because you go from this state of being in a hospital, getting treatment, now you're out, and your brain is going, when's it going to happen again? So you are constantly on edge. And when I tell you that the depression lasted a good solid month, to where I didn't work, I would sleep all day. And because your body's in that constant state of trying to heal itself, I found myself that I would get bursts of energy and work for like 3 hours, but it would completely zap me after the heart attack. And so that was something that was huge for me, and pretty much a pivoting moment when I learned about the ideology of cardiac depression, because now I could identify it, and now I could say, okay, this is what this is. So now I can pivot and get myself out of that state. So that was something I feel was super, super important for anyone that has ever gone through this, that now we have a terminology that we can identify it with, so that way we can move away from it when we can.
Yeah, I love that. Quick brag on you. I love how introspective you are. Thank you for sharing that.
You're welcome.
Truly.
Are you interested in understanding GLP-1 medications like Ozempic, Wegovy, or Mounjaro? Then join us on the Plus Sides, Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus Sides podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, Wegovy, or Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to the Plus Sides, Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together.
Sharing your story, Priscilla. Wow, so powerful. It's a real honor to be here.
Awesome. Well, we're so glad to have you. I would love if we obviously know you, but I would love if you could tell our audience a little bit more about who you are and how you help people.
Absolutely. So I am a cardiologist. I'm based in Boston. I have a little bit of a black sheep background. I mean, I'm a little different, and always have been. I grew up in a big family of doctors, like a ton of doctors. And I was drawn to sort of medicine very early on, just because I saw how directly my parents were able to help people in their average day, something that you guys are used to actually on this podcast. But as time went on, I just realized, wow, there's so much more to healthcare than just medicine, and health than just medicine. And so I wanted to learn a little bit more. I wanted to think about, like, how do we deliver the health to the people who want it or need it, right? It's not just about diagnosing disease, and it's not just about like meds. And so I learned about the existence of these programs that combine a medical degree with a business degree, and was like, that seems like a great toolkit. Was lucky enough to get into the one at Harvard, and it was great. It was really great. Obviously learned a lot on the medical side, but what I didn't expect was just a ton of learning on the business school side. I mean, really a lot. And I think that one of the things that really came out of that experience was just how many different avenues of impact, potential impact there are outside of just normal medicine and the normal medical pathway, whether it's content and, like social media, marketing, podcasts, or whether it's entrepreneurship or even just like large corporations. So I kind of was very, drawn particularly to the content marketing and also entrepreneurship side, filed that away, went on to clinical training, landed in cardiology with a brief detour in neurology. And Priscilla, your story is like pulling together everything for me. I initially thought that I wanted to be a stroke doctor, and love neurology. I actually married a neurologist. But in the first year of medical training, they make you do a general sort of intern experience where you see all of medicine. And luck of the draw, I just had like 8 straight weeks of cardiology and I totally fell in love. I mean, it was like the lightning bolt soulmate effect. And I knew that I had to divert. I wasn't able to do that without going on to do 1 full year of neurology. So I got a ton of immersion in common issues that you've already touched on that have affected you: migraines, obviously strokes, clots in the brain, and IIH, or idiopathic intracranial hypertension, and then came back to cardiology. And timing is everything, right? I mean, I started the cardiology part of my journey right as the pandemic was like really taking off. I also just like rounding out who I am. Like I had just become a mom of, my first of now 2 boys. And it was a crazy time, but I think what was happening was all the care went virtual, which was appropriate. And then as the shutdown stopped, or like all the restrictions were lifted, a lot of my patients came back to the clinic. And I really remember this one moment where I walked in to see one of my first patients coming back for their first in-person appointment in like years. And I didn't recognize her. Like it was so awful. It was mortifying for her and it was mortifying for me. But I had my little chart, I had my little piece of paper, and I'm just like striding into the exam room, ready to, hug it out and hear all about how she'd been. And I didn't recognize the person in front of me. And I, for a moment, thought, wow, I'm in the wrong room. And I'm looking at the paper and everything and realizing, no, I'm in the right room. She had gained 30 pounds during the pandemic, like so many. I mean, between being cooped up, sedentary, stressed, wildly stressed, unable to get access to care, it was a recipe for, metabolic and cardiovascular health deterioration. And so I just saw that, one patient after another, they didn't look like their former selves. They shouldn't feel like their former selves. And all of their heart disease risk factors had just gotten completely out of control. Blood pressure was through the roof, cholesterol levels had increased, and some had gone on to have like from no glycemic control problems, no insulin resistance to prediabetes, or from prediabetes to diabetes. And then of course there are people who, like you, Priscilla, had actual heart attacks or new heart failure. So it was awful. It was a little overwhelming, to be honest. And I think the thing that made it very challenging was that where normally cardiologists would draw a boundary and say, okay, wait, yes, it's a really significant risk factor and cardiovascular issue. Let's refer to our obesity medicine colleagues. I couldn't get a patient in to see my obesity medicine colleagues before 18 months. That's how long our wait list was at a top-notch Harvard-affiliated hospital. So, under the mentorship of my, this master clinician who trained a bunch of us, who actually was my grandmother's cardiologist and trained with my parents, so very close family friend and mentor, he took this very proactive stance and said, these people have already been waiting for years to get in for care. And it's going to be over a year before they can see the endocrinologist, the weight management specialist, maybe even their PCP, to be honest. Mm-hmm. So if we don't take advantage of the 20 minutes that we have with them when they're right in front of us and start treating their weight and treating their blood sugar and insulin resistance and treating their blood pressure and treating their cholesterol, we're going to be seeing them back in the hospital or after they've been hospitalized for a heart attack. And so that was really like the philosophy. And it was rewarding. It was incredibly rewarding to start prescribing GLP-1s as a major tool in the toolkit. I mean, it wasn't the only tool, but it was a big, big tool for us. And to just watch, the transformation that you all have articulated so beautifully on your own platforms and here on this podcast, not just not just sort of externally with all the labs and all the little medical data that obviously we nerd out on, but internally, and just before we went live on the show, we were just talking about like makeup and hair and like being able to look yourself in the mirror, right? And to be able to like love oneself. And so it was so rewarding, but I kind of took a step back and thought, wow, here I am, one person. I'm one of like two in this entire division of like top-notch cardiologists at a top-notch hospital who's like being very aggressive in this way and proactive. I see patients once a week. This is not a scalable operation, right? Like this just isn't going to work for the 230 million people who have overweight or obesity in this country. So, and combined with the fact that there are only 5,000 obesity medicine doctors and 8,000 endocrinologists, like this isn't going to work. The numbers don't add up. Started to think about how I could help, how can we solve this access problem, and decided, to go again, black sheep from MD MBA to like now going in this different direction, decided to build a business that would provide more accessible care. And so we are building, our company's called Systole. Systole is the moment when all the heart cells squeeze together to send blood forward to nourish the body. And it felt like a great metaphor for providing group-based virtual care, not one-on-one, but to have doctors see groups of patients. In our case, we're focusing on women first, who are suffering from what we call cardiometabolic disease. So it's obesity, diabetes, blood pressure, cholesterol, or some combo. To broaden the access to care, but also to leverage the power of what you all see day in and day out, community, right? Like women helping each other, sharing the successes, sharing the struggle, leaning on each other, practical tips that frankly, like a lot of us doctors just don't know how to manage the side effects, how to like deal with the ups and downs of just being a human being, navigating the stigma, right? So anyway, that's what we're doing. That's who I am. I also, to the fitties here, like, just going to add a little asterisk. I'm also a fitty. I'm a runner. I survived the Boston Marathon yesterday. I'm so grateful that this podcast does not require me to move at all, except my mouth. I'm just sitting here in pain. And, we say the glutes, that's the technical term. And I would say that there's nothing left of those after yesterday. So anyway, what an honor to be here. And obviously so much to dig into, but I think Priscilla's story was the perfect sort of springboard, because so much of what she's been through really mirrors the types of patients that I take care of all the time and that inspired me to go in the direction I'm going in.
And like, I do feel like when I was listening to her talk, I was thinking about, like, I hear so much, like, I don't want to call it self-diagnosing. Do you know what I'm saying? But like, I think that we have a lot of doctor aversion.
Yeah.
Right?
Understandably.
Yes. Because for so long, we've had this like poor experience, right, with many doctors. And I think that like, so I've come to a place where as long as doctors are evolving toward like, as long as they're like, like I didn't know. And like, I know now and I'm doing better. Like, and they actually are doing better, then I'm cool with it. If they're not, then like I'd say fire them. But like, if they are, like, I get to a kind of a place of forgiveness, but like, I do think it runs very deep. Even I still struggle to go to my doctor when little things happen. And I should, like, I literally preach this shit. You know what I'm saying? Like, and I think that it's just, the trauma runs very deep, and there are not enough obesity specialists. There are not enough endocrinologists. There's certainly just not enough, even cardiologists. Like, there's not enough of these people that really, really understand this disease and these medications.
I mean, if you flip the switch, right? If you flip the switch and made every PCP in the country, primary care provider in the country, competent with the treatment of obesity and other cardiometabolic diseases, that would still mean one provider to every 46,000 patients with overweight or obesity. Jeez. That's not going to work. The average panel size is like 200, 300 patients. It's not going to work. Yeah. So the system, and then of course factor in like personality and compassion and right.
For sure.
Chemistry.
And I do think that's why it's so important to have things like, nurse practitioners and things like that, because we need to be able to extend the care. And that has been a very big mission for me in terms of frankly, kind of who I want to advertise on the podcast, and what resources I want to bring to my community. And of course, there are people who are like thinking with business, like, but how can it just be me? And I'm like, because it can't just be you, right? Because if you could be the most amazing thing and serve my entire community, then if you could serve at least 40% of America, then you know what? We'd work it out. You know what I mean?
Right.
But you can't. So that's why I take it really serious, and so I'm so thankful for finding like quality care and being able to bring it, to people here. And they know that, at least I've looked into it and taken it really serious, So I think it's great. I mean, I think that having more access, and you describing kind of what happened with COVID, like it's like that was the problem with healthcare in general, right? And now it's like that is for sure the problem that has continued for obesity. Like it's just getting worse,
and worse. Yeah.
So I think it's great, and I love the community baked in. I think many of us can agree that one of the biggest differences is this time, and this time is the last time. Is the community, right? Yeah. Is having that like baked in piece of support. And it's very different than going to like a message board and seeing people post as it is to seeing people in their everyday lives and speaking to you like you were their friend, Yeah. So I think it's really cool that you offer that in your program. That's awesome. Yeah.
Thank you. No, I think it's amazing. This community, truly, it's like I've been trying to explain to other providers who are sort of curious and pharmaceutical companies. I mean, if people want to see the power of community, whether it's for education, information transfer, or just sort of, health advancement, right? Like mutual health advancement. This is example 1A, it's been amazing to sort of really observe and learn.
I think it's cool too, like just like with TikTok in general and how fast it moves.
Yes.
And kind of in a way that it's almost out of control, which is what makes it magical, especially with medicine, because medicine moves slow,
Right.
And I think that things are changing there, but I think that what's cool about it. So like I was talking with, we make this, I don't know, but I was talking with a reporter from Bloomberg, and she said, really, it's a fascinating community and it is driving the conversation, like period.
Wow.
Right. And that's true. It is like, we are not a part of it. We're starting it. Like, that's why when Oprah came on and she was like, we're going to start the conversation. I'm like, girl, you been gone a year.
You were working on Color Purple.
I love you forever, Oprah, but no.
Yeah, she's just showing up fashionably late.
I'm okay with that. Everybody knows I'd forgive her anything, but still. I'm kind of a mess tonight. Oh, Lydia. Okay, sorry, Kat, ask her question.
You're fine. That's fine. No sorry needed. Your platform. I got to lurk on your platform a little bit, and it was fun. Your platform on, of course, is heart health and obesity management. And we know all that we're all we have the impression, or we know that obesity management does help with your heart health, can help strengthen our hearts. But could you actually give us some specifics, like some of the specific correlations of heart issues and obesity and how they develop over time?
Great question. I mean, it's like one of those things where like everyone knows that there's a link, but like what exactly is the link? Exactly. What are the steps? And like how big is this effect, right? I mean, I actually find this is like really powerful information to share, not to like add to any shame or anything, but just to also like help motivate people as they're starting to catalyze their journey and starting to have some progress, whether it's medication assisted or not. So, I mean, I think zooming way out, big picture, let's just start with obesity reduces life expectancy. It cuts off years of your life. Okay. And I mean, I think the clearest way that we saw this is like life expectancy in the United States was increasing for 160 years. And then we hit the early 2020s. Okay. When like everything got so much harder for so many reasons, and it decreased for the first time. There were a whole bunch that really hit the headlines. And this was attributed to like the opiate pandemic, COVID, obviously, mental health issues with increasing suicide rates. But what no one was really talking about was also obesity. Obesity rates had really been increasing in the background. And just to like, in the spirit of specifics, I mean, you know, if you're in the BMI range of 30 to 35, your survival is reduced by like 2 to 4 years. If you're in the 40 to 45 range, your survival is reduced by 8 to 10 years. So these are really powerful depressing effects on life expectancy. And that, you know, many believe was also driving down, you know, the first time decrease in our country's life expectancy. I think it's important to note a little asterisk here is that obviously there's obesity defined in terms of BMI, but we all know that BMI is not a perfect metric, and that, you know, the fat tissue deposition, distribution and around the abdomen and abdominal adiposity really matters a lot. That sort of is what is biologically linked to like insulin resistance, cholesterol issues, and heart disease risk. And so there is, of course, a big association there. But like, so why is this happening? Why is obesity so lethal, you know, and so dangerous? And the reason, you know, what we say in cardiology is that obesity counts twice when it comes to heart health or heart disease risk, you know, because it by itself is a risk factor for heart disease. And I'll get into that shortly. But not only that, it's also driving all of the heart disease risk factors that are not obesity. So it's kind of like, you know, doubly risky. And so what are the things that it drives that are heart disease risk factors? These are what we call cardiometabolic diseases. Obesity is one, but here are the other risk factors. Type 2 diabetes, okay, which is a problem related to insulin resistance. And, you know, there's research out there saying that more than 80% of type 2 diabetes out there is attributable to diabetes. So, you know, for numbers, and that, you know, like weight loss around 15%, which is very hard to achieve without medication assistance, like with GLP-1s. Yeah. But if you're able to get there, it can actually lead to reversal of diabetes in nearly half of the people who are in that bucket of you know, that category of weight loss. So there's diabetes, there's high blood pressure. You know, we see high blood pressure is so prevalent. It's like 1 in 2 adults have it, but among people who have obesity, it's definitely at least half of the population. So, you know, that's a big risk factor there. High cholesterol and abnormal fatty lipids, which we call triglycerides. And then there's also sleep disorders. So obstructive sleep apnea is very closely linked to weight. And on the other side, very closely linked to all kinds of cardiovascular problems, whether it's high blood pressure, again, creating this sort of vicious cycle of risk, or arrhythmias like atrial fibrillation, which increase your risk of stroke, coronary artery disease like heart attacks. So, you know, all those risk factors are driven by obesity, and then out the other side are driving heart disease. But as we said before, obesity also drives heart disease itself. It's an independent risk factor for heart disease. And so heart disease is this really big category of things, which again, like I feel like the medical establishment, healthcare professionals don't do a good enough job of explaining, like, what do we mean when we say heart disease, and what exactly are we talking about? So the big buckets are coronary artery disease, which refers to cholesterol blockages building up in your arteries. And the fear is that they, you know, rupture, they become unstable and cause a heart attack. Obviously, the kind of heart attack that Priscilla was talking about at the top of the episode is sort of a, you know, happened by a different mechanism, but we can probably get to it later, how this may still kind of, you know, link together a bunch of the different biological effects of obesity. So blockages leading to heart attacks. And the other big bucket is heart failure. And then there's sort of like arrhythmias, electrical problems that can lead to sudden, you know, death related to the heart. And so for coronary artery disease, blockages and heart attacks, you know, when you look at these massive meta-analyses that pull together all the research from, like, you know, dozens of trials representing tens of thousands of patients, they looked at the, you know, we look at the connection between BMI and coronary artery disease, and there's a 29% increase in new coronary artery disease for every 5-unit increase in your BMI. It's crazy. Again, there's a lot of data to suggest that this is worse when you have that BMI distributed around your abdomen. And, you know, it's because of everything we know, the cholesterol, the inflammation, you know, obesity also with like the problems with insulin increases the activation of your sympathetic nervous system, which is your fight or flight response, which increases your heart rate and your blood pressure. Again, just like vicious cycle. And then there's heart failure. So this is really interesting and very important in terms of like how common it is. There's the kind of heart failure where your heart just gets kind of like big, baggy, and weak. Sounds terrible, but like we call that heart failure with reduced ejection fraction. That's a weak heart. But the much more common kind of heart failure is heart failure with, you know, normal strength, just kind of stiff. And that's very common in obesity. So that kind of heart failure, you know, the risk of getting it is increased twofold in people who have obesity compared to people who do not. You know, there's more that we can say about, you know, the unit increase for every unit increase in BMI, but like what's going on there? I mean, there's just so much pressure on the heart from the excess weight itself. And then of course, obesity increases how much volume you have in your blood because you need more blood to like feed a bigger body. So your heart is getting overloaded. It's like, you know, being overpumped full of blood, which causes it to kind of try to change its shape to accommodate all that blood. And it gets a little bit thicker and stiffer. On the other side of things, you have high blood pressure frequently from obesity, and that's kind of like kinking a garden hose and then trying to pump against it. So that adds more stress in the direction of a thickened, stiff heart muscle. And we see this, you know, on all kinds of cardiac testing that Priscilla probably had a lot of, like echocardiograms and, you know, now they're cardiac MRIs, which can show that there's scarring related to this. There's fibrosis related to this. So that's how you end up with heart failure. And finally, there's some evidence, growing evidence, that there might be like increased risk of arrhythmia with obesity. One of the most common is atrial fibrillation, which we were talking about before, can cause stroke because of blood kind of pooling in a top chamber of the heart that's not really pumping well. But there's also issues with more dangerous arrhythmias that, you know, is under exploration right now, but might explain sort of sudden cardiac death. So there's a big, big connection. You know, my mantra around all of this is that weight is heart health. I mean, it's not just a risk factor. It independently, you know, drives heart disease. It changes sort of how the heart functions, even if you've never had a cardiac event, and it's driving all these other risk factors. So that's sort of, you know, long answer, but hopefully one that, you know, satisfies the need to have a little bit more data, a little bit more specifics, as opposed to just, this isn't good for your heart.
Right. No, that's definitely a lot.
So we'd rather have too much data and too
All
much
the details.
Yeah, like that's why we're here and not TikTok. So,
exactly.
Thank you.
Let me tell you a quick story. I was telling Kat how I was regaining weight after my 100-pound loss using GLP-1 medications, and I was having snacky cravings and waking up at 3 a.m. and I had hot flashes, and I was worried. But Kat was like, listen, I went through this last year. It's perimenopause, and I started HRT, and she used this company called Winona. So I started going there to see if this was something that was going with me. Turns out it was, because I'm 46. And it's been amazing. It's taken a while to find the right dose, but once I did, it's just been huge. I've been sleeping. I feel more myself again. And the hot flashes are gone, which is, geez, really bad. So I will tell you, it's just been so big for me. And so I wanted to partner with them on the podcast because obviously many of our listeners are going through this same age range and definitely are having these issues. And there's just no need for you to suffer. So if you go to the link that's in our link tree, you can click on that and save money. If you go there and you meet all the criteria, and this might be something for you to try. So I just want to make sure you had this great resource because it's just been such a big difference for me and Kat. Again, you can go to the link in our link tree and get what you need. Today's episode is brought to you by Ro, a telehealth platform that's changing the game of GLP-1 access. What sets Ro apart? Ro understands the challenges of navigating insurance hurdles and the skyrocketing prices of GLP-1 medications. That's why they specialize in getting insurance approvals for GLP-1s. And if insurance is a barrier, they go a step further by prescribing brand name zepbound vials for prices close to those of compound GLP-1s. With Ro, you're not just getting a prescription, you're getting a partner in your journey that's helping you access affordable treatment and guiding you every step of the way. Whether it's insurance approvals or cost-effective alternatives, Ro is here to make sure that you get the medication you need. Visit ro.co/plussides with a Z today to see how they can help you take control of your weight management journey with affordable, accessible care. That's ro.co/plussides with a Z, making healthcare work for you. Check out the link in our show notes for more details. Are you interested in understanding GLP-1 medications like Ozempic, Wegovy, or Mounjaro? Then join us on the Plus Sides, Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus Sides podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, Wegovy, and Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to the Plus Sides, Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus Sides Podcast. You're not alone. It's not your fault.